if I could design the next opioid, it would be a slightly stronger version of buprenorphine. So it would have long half-life, a slightly, buprenorphine is a partial agonist. I'd rather have closer, not quite methadone. You take methadone and get rid of the associated the tendency towards respiratory suppression. I mean, buprenorphine is a drug that I'm starting to use a little more in terms of pain. I don't do Suboxone for opiate addiction, but buprenorphine is not a bad medicine for pain. It actually has pretty good efficacy, and it's safer than most other opiates. It's probably not quite as strong as I'd like, and there's a Butrans patch. In fact, I've told the drug reps that they need to make the Butrans patch in some stronger doses, or modify the molecule to make it more of a complete agonist. Not quite a complete agonist, but get closer to that sweet spot.
I'm going to disagree with Dr. Carter in regard to buprenorphine, because my experiences have been very different than his experiences in working with patients on buprenorphine for pain. You know, no clinical trial has been conducted that's lasted longer than 12 weeks, and interestingly, that's where in my patients buprenorphine seems to poop out. So if we're looking at chronic pain, you know, and the medication has a relatively high level of efficacy, which I agree it does, for 12 weeks, but then we see the analgesia decreasing steadily and pretty rapidly. Again, we see different patients, we see some patients in common, but I've not been particularly impressed.
We need to know more about the, I think the term is epigenetics of the mu receptors. And there are subcategories of mu receptors. So some of this is science is a little beyond me, frankly, but there are more than one classification of mu receptors, and an individual, based on their genetic profile, may have more mu receptors in certain areas of the brain. Certainly people that have a higher density of mu receptors in the sensory cortex may be better responders. So the future, in terms of developing better opiate medications, is going to be blended with molecular genetics, finding out who an individual is on a molecular basis, and then picking almost a designer drug, if you will, that would target that individual's physiology.